what is the problem with sun exposure, and what are your recommendations for sunscreen, and what are the best practices?
Sun is our biggest enemy as dermatologists. I mean, I think there's a stereotype where we're always in umbrellas and covered head
Yeah.
to toe, but there's a reason because we see the damage it causes in lots of devices that we use, dermatoscopes and things like that, that show us sun damage on people's skin.
Hello, everyone, and welcome to the Peak Health Podcast, where we explore how everyday choices impact our health in profound ways. Today, we're excited to have Dr. Meenal Kheterpal. Meenal completed her training at the University of Michigan School of Medicine and currently works at the Duke Medical Center with a focus in dermato-oncology. While Dr. Kheterpal's expertise includes treating serious skin cancers, her passion is how lifestyle changes can influence overall skin health and how simple adjustments can protect and enhance our skin. Join us as we delve into practical science-based strategies for maintaining vibrant skin at any age. Welcome, Meenal.
Thanks for having me.
Really excited to have you here. And when we spoke just several weeks ago about lifestyle and skin health, I have to say I was really blown away because most dermatologists focus on the skin only and don't really have the, maybe I wouldn't say understanding, but maybe more of the focus. The skin is not just a organ functioning independently, but part of a system as a whole. But when we spoke, you really had that understanding and passion. So can you tell me how that interest developed for you?
Yeah, absolutely. And I do think our understanding about lifestyle choices and how it affects skin, or how vice versa, skin affects the rest of your ecosystem of your body, is expanding. But my interest really started, as you said, I see a lot of patients either with serious skin cancers or just other cancers, and we're supporting their skin because they have side effects from chemotherapy or immunotherapy or other treatments that they're going through. And so often we're dealing with, at least where I stand in dermatology, we're often dealing with people that are otherwise ill and their skin is taking a hit. So there goes the connection that their skin is taking, directly being affected from all of these things. For example, in skin cancer, one of the biggest lifestyle factors that affects your skin health is your exposure to the sun.
Okay.
And as ultraviolet rays are essentially a class 1 carcinogen, it's a cancer causing agent. And we just got to be smart about it. We know now, what we didn't know before. Gone are those days of baby oil and iodine that people did. We've got way better ways to quote unquote tan our skin with self tanners. And I think the awareness is growing, and those lifestyle changes can make a huge difference.
Excellent. And we're going to talk all about that, sun protection, sunscreens, things of that sort in just a little bit. But let me ask you this question first, more of a broader picture. What are some lifestyle factors that you find that most significantly impact skin conditions? Because people, when they think lifestyle change, they don't necessarily think it will affect their acne or eczema or whatever skin condition they may have. They don't think it's truly related, but there is a relation. So can you explain that to us?
Yeah, and that's where I think we're seeing a lot of science and research going. And I think what makes it really challenging, like let's say if you're someone who lives with eczema or acne, when you dive into blogs and different things that you can read, different people are affected by different choices. Some people come in and say, well, every time I eat chocolate, I'll break out, or every time I drink this particular drink, things like that. But I can, for example, say that we have pretty strong correlation with things that have a really high glycemic index, like for example, skim milk shoots up your sugars, shoots up your insulin-like growth factor, very strong correlation with acne. So we are, I think, very active about telling those teenagers that we see that are living with acne to maybe try avoiding skim milk, things that really shoot up your.
Is it, you mentioned skim milk. I mean, there's other proteins and things in skim milk as well that folks may be allergic to. Do you mean just like anything that has a high glycemic index that would be,
Yep,
that
processed
causes, yeah.
foods. Yep, candy, all the stuff that's got just sort of naked carbs, let's put it that way.
Right.
They're not enveloped with protein and fat. You're just eating pure sugar and it's shooting up your insulin.
Right.
So I think we definitely see that correlation really well. There's other conditions too. So acne is a really common one. That's why I picked it. Another one is eczema. So a lot of people that come in that are living with bad eczema, they will notice certain foods will flare their skin. And you can get tested for some of that too. But some of this stuff is different because it's different to have testing on your skin for an allergy, but like if you're eating something that's inflaming your body in general, causing more inflammation, putting your body under more of that sort of glycemic load or otherwise inflaming your body, that inflammation is going to show up in your skin.
Yeah. Yeah, that's really interesting because 60% of your immunity is actually in your gut itself. So people think of the gut as inside their body. It's actually not. It's in fact outside your body. The food that you eat goes down this tube, and it's not connected with the sterile interior of your body. Now there is certain junctions, we call tight junctions, that are within your endothelium that protect those proteins and things from coming through. But sometimes you have what they call leaky gut, where those junctions open up and those proteins come through and you get a reaction to it. Now, I mentioned 60% of your immunity is there. So you're going to have an immune reaction potentially if certain types of proteins get through, that causes inflammation, that causes your body to get activated. And the result of that could be skin manifestations, as you described. So acne, eczema, you mentioned high glycemic food, along that spectrum, diabetes, insulin resistance, that type of thing. What else? Like, can you describe other things aside for the lifestyle of eating simple carbohydrates and things of that sort to bump up your blood sugars? What else causes some kind of adverse skin reaction?
So yeah, we are seeing a lot of our autoimmunity in the skin can be related to, you mentioned like sort of the gut barrier, and I'll take it maybe one step further. The environment in your gut relating to your bacterial flora seems to be really important. So I'll give you an example of a study. I know this doesn't relate broadly, but this is like kind of the foundation of some of the theories that we're starting to explore. There have been studies that show there are certain patients, some of our cancer patients have been through a bone marrow transplant, for example, and they struggle with a condition called graft versus host disease, which means the new immune system that has been now placed in their bodies attacking their skin constantly. And it can lead to a lot of damage in the skin over time. And so we're always trying to find ways to protect that. And it turns out the folks that actually had a very rich microbial flora in their gut, pre-transplant and after transplant, tended to have far less autoimmune disease in their skin after the transplant. And
Wow.
that's pivotal.
Yeah.
That's pivotal because not only is it preventing disease, but it's giving us an insight into how the gut flora can really affect the immune reaction into your skin. Gluten is another great example.
Yeah.
So I know there's a lot of talk and buzz about gluten, and a lot of people anecdotally, I mean, they don't have celiac diseases officially, meaning they don't have like the antibodies that a lot of celiac disease patients develop, but a lot of people feel so much better when they eliminate gluten from their diet. They feel less inflamed, their skin feels better, their joints feel better, they overall feel a lot better. So gluten, I would say intolerance so much or sensitivity can be something to look into. Now, I'm not saying everybody should do this and go off of gluten. I think the carbohydrate load versus the gluten, that's an important thing to tease out, and just kind of keeping carbohydrate intake to a normal natural foods rather than processed foods, I think is a good way to go. But yeah, I mean, I think gluten is another good example.
Yeah. Excellent. I'm so glad you brought up the microbiome because there's more and more data really suggesting that the microbiome has such a major impact in your health. So I'll give you an example of this. And my son, in fact, who was having abdominal pains, just not feeling well, really, really not acting as he should. And I performed a microbiome analysis on him. So we at Peak Health can run this test where we examine your stool, look at your microbiome, look at certain inflammatory markers. And we found that his gut was highly inflamed. He also had a elevated anti-gliadin antibody. Now,
Mm-hmm.
that doesn't mean that he's got celiac disease. What that means is that he may have a sensitivity to gluten. And I say may because these things aren't absolute. It's just like it's a data point that you have, and you kind of go with it based on the patient's symptoms and like their lifestyle and that type of thing. So what we did was we eliminated gluten. And I can tell you just from that experience that it's not as hard as people think. There's so many nice substitutes now for gluten-free food, especially like pastas and pizza and bread. I mean, we're having all of that, but it's all gluten-free. And we're really focused on the ingredients in those foods too, because you can have a gluten-free diet, but it could be very high glycemic. It could have lots of sugars. It could be not healthy for you. So you have to really look at the ingredients and make sure that they are good ingredients, and you can easily make that substitution and actually do quite well.
Yeah, no, absolutely, completely agree. I mean, I think I've heard, try to look into this myself. And again, I would say I'm a novice with trying to find some of these foods that are good for you. The number of ingredients sometimes is overwhelming, right? And certain things when you're trying to select the right kind of food. And so there are theories out there that I've tried out, and I feel my best when I'm eating the most like natural foods, right? Or things that have less than five ingredients or something simple that you can actually, your brain can actually process.
Yeah.
But yes, I think that's one thing that's challenging to do, but I think it's worth the investment.
Absolutely. When you say less than five ingredients, it reminds me of a mini TED talk that I gave to the fourth graders. It was just my son's school. They had this little TED talk session, and they asked some parents to present. So I presented a case on where this child was actually quite ill and actually had some eczema as well as
Mhm.
multiple other issues.
Mhm.
It was found that he had heavy metal poisoning, but he was also had sensitivities to other things. And the way they figured this out was through some of the testing that we typically do in functional medicine. Sometimes many practitioners don't think about these things like exposures and things like that. But anyway, what I told them was that you should really look at the ingredients. And if it's five or less, it's probably decent. Like
Mhm.
that's a better option than something that has like 50 ingredients and things you have no understanding of. And that resonated with the kids. And in fact, one of the kids I spoke with after that conference like weeks ago, he's actually my son's one of my son's friends. He was looking at something I was feeding them. And he said, "Hey, Mr. Ravi, this has more than five ingredients." He remembered he remembered the comment that I made, which was a lot of fun.
Well, that's
Um,
exactly highlights your point because something as simple as five or six ingredients, it's easier for us to process, but it's something that like a fourth grader can or third grader can remember.
yeah,
But from an eczema standpoint, the incidence of eczema has just been sort of climbing, and not just in the US, but sort of all the developed countries. But to go back to the microbiome just for a moment, like you mentioned, there is actually really good data to support that during your pregnancy, if women were to keep up their probiotic use, probiotic smoothies, however see fit. I know again, being pregnant is not easy for everybody. And so people should do whatever they can, but just keeping up with some level of probiotic substitute supplements does show decreased risk of atopic dermatitis or eczema in kids.
that's
And
amazing.
my own personal example was with my first child, my daughter. I was by the book, drank my kefir smoothie like religiously, ate tons and tons of peanuts, like all of that stuff that's supposed to avoid allergies. And she's perfect, never had a skin issue. And then I dropped the ball with my second, of course, that's the one with eczema. So I'm not sure if it's a self-fulfilling prophecy, but I think there is some data to support that microbiome enrichment starts really in utero.
Oh wow, okay, that's amazing. So to those who don't really understand what eczema is, can you just define that?
Yeah, so I think it's a culmination of a bunch of different pathophysiological pathways. But in essence, what's really happening is that your skin barrier is disrupted. Now, how that happens, there could be different ways. Like sometimes we see, well, I trained at Michigan, as you mentioned, so University of located in Ann Arbor, you got 6 months at least of really harsh weather. So sometimes the weather can lead to sort of your stratum corneum, which is like your dead layer on top, to disrupt. Sometimes in certain percent of the population, we've got a gene mutation in the filaggrin gene. And so that is a gene that produces sort of like the ceramides that allow you to lock in that barrier. So if the gene's missing, you're not going to have enough ceramides. And so you're not going to get that locked in dead layer. At times, like you said, there are things that could be inflaming potentially the gut, and then the immunity is attacking the skin and disrupting that barrier. So, whether it's an externally induced or an internally induced, the bottom line is the skin is quote unquote extremely sensitive because any little thing could flare it, and the skin has difficulty maintaining its sort of equilibrium or homeostasis. And that's kind of our current understanding of it. And of course, there's a lot of buzz about this, and it's a very common disease. So there's a lot of medications. But I think this is where you and I connected. It's like, well, before we go putting our kids on biologics or these antibodies that are eliminating certain parts of your immune system, how about we kind of take a step back and really see what else we can do? And we do that. I mean, generally we if we're seeing somebody with eczema, we're trying to explain this to them and say, you've got to get this locked in barrier, and let's figure out strategies to do that.
Yeah, I heard a great analogy recently where like if you have a fish bowl and the bowl is dirty, but you're treating the fish with antibiotics and things like that, instead of cleaning the bowl, you're doing them a disservice. And that's exactly what we're doing, right? We're not really tackling the root cause of the issue. We're just treating the symptoms of it. So tackling the root cause is really lifestyle change, which functional medicine is all about. Excellent. So you mentioned nutrition, you mentioned certain allergens like gluten, dairy is another one you mentioned as well that can cause skin flares. You mentioned high glycemic food. We're going to talk about sun in just a bit, but what about like stress, hydration, things like that?
Yeah, I mean, there's not even a question. I think I can't think of a single patient of mine where if their skin is flaring with whatever it may be, doesn't even matter if it is skin, if it is acne or eczema or hidradenitis or even to a certain degree like precancers and things like that, their moles start to change. I mean, and I've never asked them, hey, have you been stressed? And they've said, no, I'm not stressed. So I do think that the stress, everyone, all of us have probably experienced taking finals one week and then breaking out with acne the next. And all of that is your cortisol levels, right? So stress is a really important part of human evolution. Is being stressed to a certain degree that we can handle and process makes us super efficient and get our ducks in a row and get stuff done. But when that barrier is crossed and you've got this uncontrolled stress in the body and the cortisol levels are super high, I mean, skin is certainly affected, but other things too, right? I mean, we tend to eat more, we tend to sleep less. All those things, the domino effect of stress can definitely show up in the skin. I'm sure you could relate to the fact that when you wake up in the morning with only 3 hours of sleep and the rest of the time tossing and turning, you've got these huge dark circles around your eyes, right?
Yeah.
I feel like the wrinkles just tend to magnify. And
Yeah.
so I think we definitely see that. So even not just from a disease process, but even just normal skin, I think gets affected by stress.
Yeah, yeah, absolutely. They say that stress exacerbates every chronic disease, right? Like you
Right.
just, and it's certain stress is important. As you mentioned, like if you didn't have that cortisol surge, you would die. You need cortisol to survive, especially in a situation where you really are in danger. Like in many millennia ago, when we were running away from beasts and predators and things of that sort, that stress response was needed because we needed that surge of cortisol that really helped us to focus our energy not on digestion and things of that sort, but into your muscles and getting out of that potentially dangerous condition. But what happens when you have low level stress is that it adversely affects you. And that's what we're talking about, just the chronic low level of stress, that just the chronic secretion of a low level cortisol, which will not only affect your skin, but all of your other body systems like your cardiovascular health, increase your fat, disturb your sleep, and you're prone to eating more carbohydrates when that happens. So there's so many reasons why really focusing on your stress would be helpful. And there's so many ways to do it. We're not going to talk about it in this podcast because it really is a podcast in and of itself. And I believe I've already spoken about that in other ones. So we'll put the link in to this podcast for that type of information. Hydration, again, that's something that's very basic, but sometimes we don't think about affecting our skin. Can you just tell us about that?
Yeah, I mean, that's the easiest one, I think, to notice. If you've ever been at a point where you're severely dehydrated, you can literally check the level of hydration with something called skin turgor, right? So you pick up a piece of your skin, you pinch it and you pick it up and you see how slowly it bounces right back. So if you're talking about skin laxity, heavily affected with hydration. But hydration goes a little bit beyond the traditional hydration that we think about, just drinking water. Unfortunately, our body doesn't work the same way, right? You drink water, it doesn't end up in the skin and make you more full looking or the skin more tight. Unfortunately, I wish it was that simple. The problem in the skin is that to hold water in the skin, you need these glycosaminoglycans, so these special compounds, and that is what your fillers are. So I'm sorry I'm diving a little bit into cosmetics, but in order
Yeah.
to hold that moisture and that water into the skin, you need hyaluronic acid. How important hyaluronic acid is, it's incredible. It's a conserved chemical, meaning like this particular chemical structure is conserved from like the simplest bacteria all the way to complex organisms like human beings. So all of us have essentially the same hyaluronic acid. The problem with hyaluronic acid is that as we age in our third, fourth, fifth decade, we don't recycle it as quickly, just like we don't recycle our cells as efficiently. And so therefore you start to see that volume loss. And therefore, not that I'm saying everybody should get filler, but fillers that are hyaluronic acid based, as a quick side note, are extremely safe because these hyaluronic acid products are made from a very, very simple formula in a way that it's conserved through. So it's unlikely to get a reaction to it because literally every organism has hyaluronic acid as part of their structure.
Interesting. So you're saying your skin cells naturally just produce hyaluronic acid, and that is what the barrier is, preventing moisture from escaping our skin.
Yeah, let me tweak that just a little bit. So there's two layers to the skin. So you've got the epidermis, which is the surface.
Right.
And I will say the hyaluronic acid, like when you see moisturizers over the counter, or even some of the ones that you see being sold at dermatology offices, you'll see HA or hyaluronic acid. It is a compound that is by definition supposed to hold on to water and retain water. And I think that's what you just said, that if I understood you correctly, if you're using a moisturizer with hyaluronic acid, you're likely to help that skin. And we were talking a little bit about before we started how every decade of life your skin does something different. If you're a 20-year-old, unless you have super sensitive skin, you probably don't need a ton of HA because you make a lot of moisture.
Right.
However, someone like myself in my 40s, skin gets drier. You don't have the same hormonal stimulation of the skin regeneration. So a moisturizer with hyaluronic acid can be really helpful. And I think people should at least try it, and you'll see what a difference it makes to hold the moisture from your moisturizer into the skin. The other reason why I really like it is because it's not oil-based. So it's another way to keep moisture in the skin without an oil-based moisturizer. And oil can sometimes plug pores and things like that, create acne even in your 30s and 40s. So
Hmm.
we like HA-based moisturizer. And I think when you use it, you can feel the difference and how long the moisture is retained. Now, the second part of this little bit of a tangent that I'm on is the dermis, which is the second layer of the skin. So
Right.
when you get to a certain point in your life where you're looking in the mirror and you're like, wow, I really look very different than what I did in my 20s. And I want to go back to looking like I did. One of the easiest ways to restore volume is to take that hyaluronic acid and use it as a filler. So it's an injectable. And used to be that we used to put it in the skin and there were could be some side effects, but now we use it like periosteally. So if we use a filler, it's going sort of right on top of the bone, giving you the most volume, and it's the safest sort of plane to inject. And as a chemical, hyaluronic acid is extremely safe, which is what I was alluding to earlier. It's one of the safest fillers, and that can kind of restore the sort of the volume that you probably had 10 or 20 years ago. So
Oh,
hyaluronic acid plays a big role in skin.
okay. So, and if somebody elects to do that, they would go see their local dermatologist, and do most of them do those types of things, or do you have to see a specialist to do those injections?
I mean, there's certainly cosmetic training. I think it is part of every dermatology residency. But yeah, I mean, I think there are lots of folks that do it. Now, how do you find someone that's had a lot of experience? I think you just have to ask how many
Right.
of these people have done. And I know there's some nurse practitioners and physician assistants doing it, and there's a lot of med spas doing it. So you just have to dig through, get the reviews, and do the due
And
diligence.
how long does it last for?
Good question. So it can last, depending on where it's put and how much and what the purpose was, between 6 to 18 months.
Okay. 6 to 18 months, you said.
Mhm. There are
Okay.
certain other types of fillers that are not hyaluronic acid that can be almost permanent or semi-permanent, but then we're getting away from like the safe, reversible type of option.
Okay. Okay. So that's a potential, and it's very interesting to hear. Whenever I think of cosmetic practices, I automatically just sort of get a bit apprehensive because there's so much. You hear so many horror stories about people going through certain procedures and having adverse effects, and you see some of these actresses mostly. I was watching this movie on Netflix recently. I can't remember the name, but it was Nicole Kidman who's in that movie, and you can tell she had all this kind of work, and I'm like, that does not look good on her.
Right.
You see that, and you're like, okay, I would never recommend that. But what you're saying is this is different. This is I don't know what she had, but this is very different.
Yeah, I think what you're describing is this phenomena called drift. And I think there's a few dermatologists that have really popularized this, or I guess there's more knowledge about it. You can put filler in different parts of your face, and a millimeter more volume can change the way you look. Like, for example, lips are a really good example. You put a little too much filler in the wrong place, and you don't even look like yourself anymore. So one good strategy I would have is that instead of showing your dermatologist a picture of Instagram model that you want to look like, bring your own photograph from 10 years ago or 20 years ago. Because then you're restoring what you want to look like, what you should like, what people see you as, versus drifting off to look like essentially someone else.
Right.
Or if that's what you choose, then the people can tell the difference. Human brain is very good with picking up a difference where you start to not look like yourself anymore. And that's not just fillers and Botox, but it could be with facelifts and all sorts of cosmetic procedures that can completely change the way someone looks to other people. And so that's a phenomenon called drift. And to be aware of it is important. And again, looking like not like yourself could be a choice as well.
Yeah.
But yes,
Yeah.
then the reaction is like, oh, why would you do this? You look great before, potentially. So
Right.
yeah, it's a slippery slope sometimes. But
Okay.
yes, usually when we do it, we just say, bring a photograph from 10 years ago, 20 years ago, or a photograph where you thought you looked really good. So then we know we're on the same page
Yeah.
as what they're looking for.
Okay. So if somebody doesn't want to go down that path and wants to stick to like topicals, and we initially were speaking about hydration. So this would be topicals to just maintain skin hydration. What do you recommend? And brands, if you're comfortable talking about that, I know you have no, well, I don't know if you have any affiliation to any particular brands, but happy to get your recommendation on certain brands too.
Yeah, no, I do not have any affiliations with any brands from a cosmetic standpoint. So I can tell you the things that I have used that I really like. Again, there's probably a ton of other products on the market, but I try to find things that are economical as well, because there's no reason, first of all, I would say, to spend hundreds and hundreds of dollars on skincare.
Yeah.
So, and then in that same vein, and I think a lot of other dermatologists that I follow that are probably way more in tune with this stuff than even me will say the same thing. Having a simpler routine that not overcomplicating it keeps it, I think there's less is more. Also, because as we were talking about with food, because skincare products can have a lot of ingredients too. And if you have like 15 different products in your routine, you can tend to get sensitive to something and there's a challenge to figure out. So I would say from a hydration standpoint, we talked a little bit about like a humectant like hyaluronic acid, for example, but then there's other things that can actually lock in that barrier. So a few moments ago, we were talking about that flagrin gene or these ceramides that are important to lock in the skin. And so now we have moisturizers with ceramides, and ceramides is actually spelled with a C. So it's CEDE. And this is great for folks with sensitive skin, eczema, but just even as we age in our third and fourth decades of life, we don't have the same level of sebum production and oil production that we probably had as teenagers. So important to replace some ceramides. So the traditional brand that's really started, our pioneer brand, I should say, is CeraVe.
Uh-huh.
And that's available over the counter at a very, very economical price range. So I love their body sunscreens. I like their facial moisturizer with ceramides, their night cream with ceramides. So I think replacing ceramides can be really helpful. Eucerin is another one. Actually, Eucerin Advanced Repair is actually my favorite moisturizer that we use for a lot of our patients who unfortunately are also living with cancer and their skin barrier is truly destroyed. Their immune system's completely haywire. So we use a lot, but I use that on my kids. And actually that is how I cured my son's eczema is with Eucerin
Okay.
Advanced Repair. Now he doesn't let me use it on his body because he runs away from me, but it did work beautifully. So I think from a skin barrier perspective, I think using something with ceramides can be really helpful.
Okay, that's great to know. Just a quick point. There's somebody that I follow on YouTube. His name is Bobby Parrish. He's got this site called flavecity.com. I really like, you can Google him. I really like his YouTube channel because he talks about every different type of product and food. And it's not just products, it's food as well. And all the ingredients, he goes through them and then he describes the good ones, the bad ones, whether he approves something or he doesn't. And a lot of the brands that you mentioned, they're petroleum byproducts, and there's other types of chemicals in there. So personally, I try to focus on really high quality types of products with few ingredients that are mostly organic. Are there products like that that have ceramides that people who really want to focus on those types of things?
Yeah, I mean, I think the ceramides are, I think like you also want to kind of get some level of data on like if brands are testing the ceramide and the quality of the ceramide that they're putting into their product. Companies like Neutrogena or Aveeno or all the likes. I mean, I know that they invest a significant amount of R&D money to make sure that the quality of the ceramide is also there. But you're right. Like if something like a petroleum byproduct was a no-go, and it depends on what the particle size is of the byproduct, because your skin can only allow so much to get through. And so if it's a particular product that, yes, you put on the skin, you don't want it to be absorbed, but it can't get absorbed because the size is too big, then it's like likely safe and it's just staying on the skin. Like, for example, petroleum jelly.
Right.
So that's one of the products that we know heals the skin better than anything else is Vaseline.
Right.
And that's totally just petroleum jelly.
Yeah.
And so in the skin, we don't worry quite as much about petroleum byproducts because we in practical life we see those products being extremely helpful. And I suspect, and I'm not 100% sure on this, but I suspect because the particle sizes are just too big. Same thing in the gut, certain things that just will pass through and won't get absorbed.
Yeah. Okay. That's good to know. I'm gonna have to cut this part because so note to editor, just cut this part out because I'm looking at, there's a question that I'm blanking on now. I was going to ask you. Oh, types of products that cause adverse skin reactions like preservatives, fragrances, things of that sort. Okay, editor, you can continue here. Okay, so thanks. So along those lines, can you talk about certain types of products that people have an adverse skin reaction to? Because I remember learning many years ago that certain types of maybe cleaning agents or Tide, for example, people can have an allergic reaction to. What are some of the common ones that people should be aware of so potentially they could switch them for something that's less irritating?
Gosh, now you're talking about a whole science field in our specialty, which is like allergic contact dermatitis. And sometimes it's not just allergies, it could be just an irritation.
Right.
So I could try to hit some of the high level points, but yes, this is where, yeah, like you said, we could record a whole another podcast episode.
Right.
But like you mentioned before, so fragrances and preservatives are sort of our top two categories. And there's some unique things like someone says, oh, I've got this rash and we think it's contact dermatitis. There's a top 10 list of things that we think of. So I can try to run it down for
Yeah.
our listeners. So number one, like you said, Tide, full of fragrance. Little tidbit there, you want to look for, so let's say you and your primary care or your physician, or you've determined that you may be allergic to fragrances. You want to look at a detergent and you can't just look and see if it says unscented, that is not the same as being fragrance free. So unscented means that they could still put in chemicals that mask a poor fragrance. So what you really want to look for is fragrance free, and a couple of brands that you can look for is like All Free and Clear. Same thing, and it extends beyond just detergents, right? Shampoos, soaps, things of that nature. Downy and those dryer sheets, that fragrance, all those fragrances can be pretty irritating as well. Now, not everybody's irritated by them or is allergic to them. So if you don't, you're one of those lucky ones. You continue to put Downy in your clothes, but if you're trying to get a reaction, that's probably a good place to start. As far as preservatives, we see that a lot in like things like baby wipes. So our poor kids are exposed to it. A lot of the baby products used to have this cocamethylbetane, which was another chemical that used to be like what made Johnson and Johnson smell like that amazing baby soap
Right.
fragrance.
Yeah.
We're getting away from that because we see a lot of reactions in our kids. Kids get sensitized to it. And so we try to, again, go with All Free and Clear or Aveeno or something that doesn't have any fragrance. Eucerin's another great product. So fragrances and preservatives for sure. But if you suspect that you're having some kind of an allergy on your skin, then there's something called a patch testing you can do where they put in north of 80 to 200 allergens on the skin, patches on the skin, and they can test you from everything from like the stuff I said to something like even gold, super rare.
Okay. So the top two: fragrances, preservatives. What about oils, surfactants? Also, are those also issues?
My understanding, and I could be wrong, but my understanding is that typically they're disrupting the natural oil barrier on your skin. So the ceramide barrier and the natural oils that we produce,
Okay.
surfactants, that's what their job is, right? So that's where we kind of say all soaps are dry. There's no such thing as a good soap, really, but there's some that are extremely harsh.
Yeah.
So yeah, they basically disrupt that sort of oil barrier, also disrupt the normal microbiome on the skin.
Okay. Okay.
So it's almost like we were trying to get too clean, but we want some of that bacteria on the skin that are good for us.
Yeah. And I would like your comment and feedback on this, but what I really focus on is SLS, or sodium lauryl sulfate, which is very, very common in cleaners, shampoos.
Right.
And that can strip the skin of natural oils, leading to dryness, irritation, barrier disruption, as you're mentioning. So when I'm looking at a particular cleanser soap, I try to avoid SLS.
I think you're absolutely right. I mean, we're really talking detergent level strength here. We're not washing dishes.
Yeah.
We're washing our hair and body. So it's a completely different. We want to not overdo it. And even like as we get older, washing hair maybe 2 to 3 times a week is plenty. We don't need to be going, because every soap is going to have some level of grease taking away ability. That's kind of why it is a soap. But yes, I think SLS is a great example of something really harsh.
Yeah, yeah. And I really recommend those of you who are interested, Google Bobby Parrish. He's got an app, in fact, where you can actually scan any type of product and he'll go through that product with you on the app and tell you if he approves it or not. It's called Bobby Approves. There's other companies. I'm just focusing on him because I like him, but there's other companies that do it. Environmental Working Group's another one. There are many others. But just look for some of those apps. They're free. They're easy to use. You can scan these products, figure out if they have some of these types of irritants, and you can try another one that's more natural. Excellent. Okay, so we've been talking about sun exposure for a while. We haven't gotten to it. Let's get to it now. What is the problem with sun exposure, and what are your recommendations for sunscreen? What are the best practices?
Sun is our biggest enemy as dermatologists. I mean, I think there's a stereotype where we're always in umbrellas and covered head to toe, but there's a reason, because we see the damage it causes in lots of devices that we use, dermatoscopes and things like that, that show us sun damage on people's skin, right? But yeah, I mean, it's a class 1 carcinogen, and that goes for tanning beds. Not even sure how they're legal anymore. But let's talk a little bit about sunscreen and their ingredients. And I think there's a little bit more awareness, but I want to kind of go back and talk to everybody about when back in the 1970s, we had some of our first sunscreens kind of come on the market. So a lot of the due diligence and testing ability that we have now wasn't available then. So avobenzone was one of those sunscreens that was approved back then. And then there's a whole host of other sunscreen ingredients that are kind of like same thing, like byproducts of petroleum and things like that, or benzene products that are approved. The problem with them is they didn't have the same kind of rigorous testing. And now that we do have that testing, we realize that all of them are essentially UVB blockers. So in the ultraviolet spectrum, what is more harmful is UVA, and UVB is actually partially helpful because that's what makes vitamin D in the skin, which is really important for homeostasis of the skin and preventing skin disease. And UVB is what we use as dermatologists to cure psoriasis, eczema, skin lymphoma, and all sorts of other problems in the skin. So UVB is actually helpful. So you've got all these sunscreens that are benzene related products that are blocking UVB and doing really nothing for UVA. Avobenzone is probably the only partial UVA blocker. So it's not blocking all of UVA. So fast forward now, and now we understand that our mineral sunscreens, zinc and titanium dioxide, so zinc oxide and titanium dioxide, are far better and superior at protecting against UVA. Zinc's a little bit better than titanium. So as we were talking earlier, zinc, at least 6% or higher, is kind of what we recommend in sunscreens for anyone that wants to protect their skin truly. In fact, the FDA has only approved zinc and titanium for kids. Those are the only approved sunscreens. And sunscreens are really an adjunct protection. So you have your sunscreen on and you're at the beach and you spend a whole day in the sun. That's not what we're talking about. I mean, sunscreens break down every hour to 2 hours. So either you're reapplying or you're protecting yourself some other way, like seeking shade temporarily and things like that is really important. I do want to interject a little bit there because zinc and titanium, I think a lot of people may be familiar with and may be using. There are micronized zinc formulations. So like we talked a little bit about Badger before, Elta MD is another one. These formulations basically break down the zinc so it doesn't look so white sometimes on your skin. So you're not looking like you're essentially gray or some funny complexion. So I think those are completely reasonable products to use. But I will say there's a third kid on the block, a third amazing sunscreen blocker, iron oxide. And that is available in the tinted sunscreen formulations. What's really cool about iron oxide is it also blocks visible light. So we see a lot of, so as we were talking about, by the decade, I mean, you start to see, especially women in their 30s and 40s, starting to get some hyperpigmentation, melasma. Sometimes people have skin lupus, or in general, just start to get rosacea and get sensitive skin. The go-to sunscreen you really want to get is iron oxide. And usually that's in combination with zinc and titanium. So generally, those are the tinted sunscreen formulations that have the iron oxide. So strongly recommend that.
And is that one of those that is quite visible? Like you can see the white sort of paste on your skin if you use it?
It actually dulls it. So that's another nice habit forming. You're putting this formulation that's kind of molds in with your skin color because it's tinted. And so you're not looking white or gray or so it actually goes on the skin nicer. In fact, a lot of the women that I have recommended to, they use that as just their makeup. And it's easier to also get a lot of men to use it because it doesn't look like that white sunscreen that gets in your beard or just kind of stays there. So it masks the white of the zinc, but it also protection against visible light. So it's really covering the spectrum much better. And we're seeing a lot of great data about how well it protects against the visible spectrum for some of these skin diseases that are more exacerbated.
That's really interesting. So your recommendation is zinc or titanium plus iron oxide?
Correct.
And what sunscreens can one buy to have that has those ingredients?
We're seeing actually almost all major brands trying to get some iron oxide or some version of tinted sunscreen. So I've seen it with Eucerin. Eucerin actually just released their sunscreen line, or their facial skincare line, and tinted sunscreen is one of them. The reason I mentioned Eucerin is because the price point's really great. I think it's somewhere between $10 to $15. So when patients say, "Oh, I can't afford it, sunscreen's so expensive," I'm like, I don't want to hear it. It's like, if you can afford a McChicken sandwich, you can afford Eucerin sunscreen. Elta MD and La Roche-Posay are a bit more expensive in the, I think, $20 to $40 range. So I can see why that can become a little pricey, especially those folks that are using and reapplying it, truly using and reapplying it. But I think CeraVe has another line. So yeah, so all major brands probably have a tinted sunscreen, but you just have to look for it and know why you're looking for it. And that was my whole purpose of kind of going into this a bit more.
Yeah, okay, that's very interesting. And then the sunscreens that have those chemical ingredients like oxybenzone, avobenzone, things of that sort, do you not recommend those at all? No chemical sunscreen?
No, I would say some sunscreen is better than no sunscreen, right? That's where I stand. These chemicals we know for a fact are absorbed into our skin. So as we were talking about earlier, certain products, the chemical structure is such that it's small enough to be absorbed in the skin. Not only are they absorbed in the skin, they are actually absorbed into your blood and other tissues.
Yes.
And we can see them in the urine and blood. When you test people for years after use. So knowing that things like avobenzone and other chemical sunscreens are being absorbed and retained in the body is important. There's certain, like oxybenzone, that particular chemical was already shown to be harmful to like the coral reefs in Hawaii. So they're actually banned in the island of Hawaii, or islands of Hawaii. So we know that it affects life in some ways. To date, I'm not 100% sure if we have firm data that absorbing all these chemicals and retaining them in our tissues is causing some sort of harm. So I can't say don't use them. And that is why the FDA hasn't, but there's active research going on.
Okay.
But they're just not good.
Yeah, yeah,
They're
yeah. It's
not
like why use them if you have another option that's
exactly.
even more beneficial, then
But I
why
will
not?
tell you, yeah, absolutely. And the problem is that these are the ones that are in our spray sunscreens. I think the
Yeah,
problem is that they're really easy to apply. And I'd rather somebody not get a bad sunburn that's going to give them a melanoma, but
yeah,
I wouldn't put it on my kids.
yeah.
I would use zinc and the mineral sunscreens.
And can you get mineral sunscreens in spray bottles? Do they
I
actually
believe so. I don't
you have
believe
to?
so.
Okay.
I'd have to check, but I think most of the mineral sunscreens, the ones especially for the kids, like the Blue Lizard, which is an Australian brand, which is completely paraben free and great for kids. All of those are, you got to do the hard job of applying it
Yeah,
onto the skin.
yeah. And I don't think I think it's not a it's not so difficult if you think about the benefits of it. Just takes a few more minutes. The Blue Lizard brand, it's funny you mentioned that because again, I was using that Bobby Proves app and I was looking at that Blue Lizard versus
Mhm.
Badger, which is the one I use, the sunscreen I use. And the Blue Lizard does have, I can't remember what chemical it has, but it has something that this particular person did not like. And the Badger is purely natural. But as we were discussing previously, like it's not just necessarily one or two particular chemicals. It's other aspects of it. Like the Badger has oils. I think sunflower. I think you mentioned
Right, right.
sunflower oil, and maybe people might break out with have an acne and flare with that type of oil, or maybe have some other adverse reaction. So it really depends on each individual. But I just lean towards the more natural products. I like those.
Yeah, no, you're absolutely right. And the Badger sunscreen has like, I think less than 5 or 6 ingredients, which kind of meets that simplicity rule, and it's
Yeah,
easy to analyze. But I mean, it's interesting. I have to check out this app because at least it's giving you more information than I would have otherwise known about some of these ingredients, especially the esoteric ones that are not in every product.
yeah.
And so I think it's good for people to at least take a look at it and learn a little bit more. If nothing else, you learn a little bit more about the products that you're using.
Absolutely. One more tidbit about sunscreen. People look at the SPF value and say, oh, if it's SPF 70, I can just put like there's a little bit here and there. But the truth is it's like SPF 70 means that there's a certain barrier that you have that equals SPF 70. Can you describe that more in more detail? Because that's a big misconception that people have, is that they think that high number is all that's needed. They don't realize you have to put a certain amount on their skin.
No, that's an excellent question, and one that I try to explain all the time, but I'm going to go to the headline with that really right up front. I'll explain later why. So anything over 30 is fairly useless. So you pretty much need a 30, and anything beyond is just just, I think, making it seem. The reason for that is that what sun protective factor, SPF, really is the time that it would take you to burn with that sunscreen on, like burn your skin or have an adverse reaction to the sunlight or ultraviolet radiation with the sunscreen on than without. And so an SPF of 4 means that, like, if you are somebody that's an albino or you're a redhead or a blonde, somebody super fair, it takes you 10, 15 minutes to burn without that sunscreen. Now you're going to burn in an hour. And so, but every sunscreen generally breaks down somewhere between 80 minutes, around that ballpark. Some of the water resistant ones may be a little bit longer. But the idea is that if every sunscreen is breaking down in 80 minutes, anything over 30 is really not going to be that helpful, because that is that inverse proportion of time. So we say, well, maybe 5 to 10 might be too low, especially because there are some folks that are really fair. They step out and within 5 minutes, especially around the tropical areas like Florida, it can burn. So we usually say 30. But I think it's more important to look at the ingredients, the ultraviolet protection spectrum, how much UVA coverage you're really getting, because UVA rays are the ones that are really toxic to skin and more mutagenic. And then also reapplying that sunscreen, trying to get away from peak sun exposure between 10 and 4 p.m., where you're getting the highest ultraviolet A, and those kind of things are, I think, just as important. So I hope that makes sense. But
yeah, that absolutely does make sense. So SPF 30 or above is important. What about like 30 versus 70? Does it matter?
You got to still reapply it you could do 70, but you still got to reapply 80 minutes in my book.
So okay. So really, it's like there's not much of a benefit to 30 versus 70, because you're going to have to reapply it in 90 minutes anyway. It means like sunburn in 30 hours versus 70 hours, which is sort of like, if you do get sunburned in an hour, it would be 30 hours versus 70 hours, which is like a long period of time. The benefit is decreasing over time.
Yeah, I mean, I think if you're in direct sunlight, that sunscreen is breaking down, right? So in about a couple of hours at most, you're still going to get burned, even if you had a high SPF. Now, you mentioned a really good point earlier. Could you then use 70 and use a thinner layer? And the answer is no. Because I forget the exact volume, but all sunscreens are tested where one of those, if you had a shot glass, you're really using I think a full shot glass worth of sunscreen over a certain square foot. I forget exactly, it's 100 square foot. So I can get back to you actually about the exact, but I mean, you kind of are putting on sunscreen to a point where it is a borderline uncomfortable amount of volume to get the true protection. So 70 doesn't mean you apply less. I can tell you that much.
Okay. All right. Good to know. Okay. So one last question before we just jump into concluding here. So both you and I in our 40s, people in their 40s, they're trying to look younger. They're trying to maintain a routine so that they maintain some semblance of youth as they were back in their 30s or 20s. So what are your recommendations aside for the cosmetic stuff? Put that aside. Like, what would you recommend for those people?
No, I think maintenance is so important, and there's so much you can attain with just having a really good routine. So I love this question because obviously I'm very interested in it, but also because when we first met, you mentioned to me that your research on the vitamin C, ferulic acid, as a medical student, I can't tell you how valuable that was, because that's probably one of the best antioxidant products on the market. There's a lot of vitamin C's, but ferulic acid is one of the most data-driven product out there. So it's a nice, I was just so amazed by the fact that you actually had worked on it as a medical student. So pretty awesome. You've been kind of following that trajectory.
I was actually finished my internal medicine residency, and I was contemplating reapplying to a dermatologic residency after.
Oh, nice.
Yeah. So I did research at Duke, where you're working for a year. And
That's awesome. Well, I hope that research didn't drive you away from dermatology, but it's full circle now. We're talking about this again. So it's pretty
yes,
cool.
exactly.
But yes, I mean, I think so. The nice thing about so I can just tell you, I mean, there's different things that work for different people, but I think there's a few things in our 40s that are really important. So number one, we've now, unfortunately, like it or not, accumulated quite a bit of ultraviolet damage and continue to do so, right? As much as we try. So sun protection, of course, we talked about. So in the morning, generally, I mean, you want some level of antioxidant to kind of brighten up that skin, and that's where vitamin C comes in. So vitamin C is this sort of a non-toxic, natural way. The only problem is natural. Like if you just squeeze lemon on your face, it's just the ascorbic acid and some of those acidic things are going to disrupt your barrier. So the tricky thing is to find a formulation of vitamin C that is not acidic and that also penetrates the skin. So ferulic acid by SkinCeuticals is one of the nicer products. Although I've recently tried La Roche-Posay, and their vitamin C is, I feel like I can notice it a little different in my skin. Maybe you can tell me when we see each other next. But I think a morning routine with like a gentle cleanser and then a vitamin C serum that you like the price and the feel of is really important, followed by a sunscreen.
So vitamin C ferulic acid combination.
Well, ferulic acid is kind of a form of vitamin C that,
Got it.
yeah, so it's like a formulation that penetrates the skin really well and has been shown that all that kind of brightening, lightening of age spots and things like that. The challenge comes with the nighttime routine because in our 40s, the skin's not quite as oily and it doesn't have the same level of sebum production. So we say the holy grail of anti-aging, the one product that has the most amount of data is retinoic acid, right? So that's your tretinoin, and you can call it by different names. Retinol is a version of it, but retin-A, micro, all those formulations. But no matter what you do, retin-A can make you kind of, it can irritate the skin. It definitely thins out the dead layer of the skin, so it can make you a little bit sun sensitive and also a little bit dry feeling. So how do we combat that? That's like the most common question I get. And that's where our sort of HA moisturizers come in. So we kind of recommend like a sandwich technique where you're putting on, if you want to take your makeup off or just wash your face and then with a gentle cleanser, and then you're kind of using like a hyaluronic acid moisturizer, then applying your retin-A, and then putting on a second moisturizer or maybe an eye cream or something like that. That kind of sandwich technique works for a lot of my patients personally, and for me at least. So you're not sort of peeling and getting irritated skin from the retin-A all the time. But if you can find a way to use retin-A every night, the trajectory of skin is going to be completely different in 10 or 20 years because all those fine lines, it improves, and also it stimulates collagen underneath the skin, preserves the collagen that you have and stimulates growth. So all of those things are really important. But this is the field that we will hopefully see a lot of new research in because we're seeing a lot of products that are going to be coming on the market that are looking at that collagen fibroblast stimulation. Safety obviously to be determined, but I think this, like you said, if you don't want to do Botox and fillers or injectables, what can you do? And I think that market is going to be exploding over the next 5 years.
Okay, so your recommendation is number one, did you say use the tretinoin at night or
You
morning?
have to, yeah, it breaks down in the sun. So
Okay. So hyaluronic acid, and then what brand of hyaluronic acid do you, we spoke about this before, but what do you use?
yeah, the most economical and easiest to find is the Neutrogena. I think it's called the Hydro Boost. And then, but there are tons. I mean, I think if you just go down the aisle at Target, I mean, I think even popular brands like Hims and Hers and things like that, they have like, but I personally used Hydro Boost, I think from Neutrogena, and do like that a lot.
Okay. And
Notice.
then you use the retin-A, the tretinoin, and then you recommended to start like at a lower dose and then increase over time as it could be
Yep,
drying.
that's the goal. So start with a lower frequency, even I would say every third night or something, or and like maybe start at a lower dose. Like for example, one of the really good retinoids that are on the market that are over the counter is different, which is like the lowest strength and the most stable retinoid. So maybe starting there, you can get it for $12, I think, at Target, and an easy one to start. No reason why everybody shouldn't be on it, frankly. Couple of notes of caution. I mean, if you are pregnant, I think it's a pregnancy class C, and to each its own on that. So a lot of it depends on what you think of your OBGYN thing. So you probably don't want to do that maybe during pregnancy and nursing, but retin-A is really amazing because of the fine lines, the collagen growth and preservation, but also lightening age spots. Which is something that we start to see with folks in their late 30s, early 40s. It can help melasma, rosacea. So it helps with a lot of skin conditions. And so it's sort of a go-all for everything. Another thing I would just mention, another ingredients that's been sort of a buzzword, but I do think it helps a lot with inflammation is niacinamide.
Okay.
So niacinamide, you could take it as a supplement, is probably better than me. But it's been strongly linked with reversing mutations in the skin. So we see less precancerous damage. And then for those folks that don't have precancers, we do think it helps with anti-aging orally. But you can also look at products with niacinamide for the skin for just better absorption.
I see. Okay. So, and in the morning, you mentioned SkinCeuticals. You also mentioned another brand. What was the
Oh
other
yeah,
brand?
La Roche-Posay.
La Roche-Posay. Okay, so one of those two brands of ferulic acid, it's a ferulic acid based
Right. So
hydration
yeah, the
cream, right?
ferulic acid is like sort of like the brand name for the SkinCeuticals. La Roche-Posay I think it's called the vitamin C serum, or that's kind of on the label. So you're basically looking for like a vitamin C formulation.
Okay, and then you use that in the morning.
Right. And
Okay,
your sunscreen. And your sunscreen.
and sunscreen. Yes, very important. One thought on sunscreen is obviously we're worried about our face in terms of aging. So using sunscreen in your face, but if you're I think the confusion often comes with people when they when they hear me and other people talking about vitamin D production and exposure to sunlight, also the infrared benefits of the sun. And there's many benefits, but the infrared, it passes through any kind of barrier. But like the vitamin D generation, like I think my thoughts are use it on your face. If you're just going outside and then normal as you are normally, you don't necessarily need it on the rest of your body. If you're going out for a longer period of time, you can apply it. But to generate enough vitamin D without supplementation, you do need to like have your trunk exposed. You need to be at the right latitude. You have to be outside for about 20 minutes. Like it's not easy. That's why vitamin D is so important. I recommend supplementation in general. But as far as sunscreen goes on a daily basis, I think your face is adequate. What are your thoughts on that?
Yeah, I mean, completely agree with to generate vitamin D in the skin would be amazing if we could all do that. But like you said, most of us, even if you don't wear sunscreen on your face, I mean, you're in an office building most of the time inside, and it's not logistically possible. So I think for the effect that it has on bones and just even now prevention in terms of cancer, I mean, there's just so much great data on vitamin D. Supplementation is amazing, just at least fortifying your diet and taking a supplement. As far as the skin is concerned, sunscreen on the face, obviously very important from an anti-aging standpoint, but just even from a skin cancer standpoint, I would say basically head and neck.
Right.
A lot of the patients that I do see, at least men, a lot of them have unfortunately lost their hair. So scalp is probably the most highest risk from a skin cancer perspective.
Yeah.
So at least the scalp, posterior neck, maybe ears. Interestingly, your arms and hands and like sort of like I would say extremities, they resist at least carcinogenesis or cancer development a lot more than head and neck. Not sure why, but we see some of the most aggressive tumors on the head and neck. So I will never say stop at the face. Scalp, ears,
Yeah.
neck is kind
Yeah.
of like the bare minimum
That's yeah.
in our world.
And that's what I meant by face is certainly head and neck is very important. Excellent. Well, this was extremely helpful, and I'm sure our listeners got a ton of information out of this. If they want to contact you, learn more about you, how would they do so?
I think the easiest way would be to email me. It's kheterpal@gmail.com, and I'm happy to answer any questions. And I would say the same. I think I've learned so much from you on this podcast, and hopefully we continue this journey of connecting skin and diet and lifestyle
Yes.
in the future.
I am sure people are going to want more of this. So I want to invite you now to a second episode because I know that people will want to hear more about skin health. It's such an important topic.
Well, I love skin and just skin health and overall health. And so anytime I would love to.
Excellent.